Well, hello and welcome to the Psychedelic Diaries. I'm your host, Ray Christian, and do we have a show for you today? Dr. Randy Scharlach will be joining the show. We'll do a deep dive and a soul search with him. Producer Kevin is here. And as usual, we'll have a nugget and a noodle. So today's news nugget, the NIH director, Francis Collins, has praised psychedelic use. Now, it's tough to overstate what a sea change this is from the last 10 years, but he is pushing the federal government for more efforts in psychedelics. What a time to be alive in this psychedelic renaissance. We'll get to the noodle at the end of the show, and we'll talk about the overlap of precision medicine and psychedelic guiding. But producer Kevin, do we have Dr. Scharlach on the line? We do. He is a renowned oncologist, radiologist, and currently the medical director and on the board of advisors at one of my favorite psychedelics companies, Field Trip. Dr. Scharlach, thank you for joining the show.
Well, thanks, Ray. I loved your intro about the NIH director's comment. It makes me think of the way Richard Nixon characterized Timothy Leary as the most dangerous man in America. So for the director of the NIH to be advocating the value of psychedelic therapy is certainly a 180 of our government's position.
Yes, what a stark juxtaposition. Good call out. So, Randy, if I may, let's jump right in. You are a renowned oncologist. What was it that compelled you to start working in the field of psychedelics?
Not sure I'm quite renowned, but I'll take that as a compliment. Thank you. What got me working in psychedelics? Well, I'd say there were two stages. The first stage was when I was completely naive to any type of mind-altering substances. I grew up in the 80s. I was a product of mind control from Nancy Reagan's Just Say No campaign. I believed every word of it. If any of your listeners are old enough to remember the commercial with the pan and the fried egg, this is your brain on drugs. I was like the one kid in America who actually believed that. And so I stayed away from all of these substances until I was in my 40s and was suffering from a really significant depression. I was seeing a psychiatrist. I was on 4 different medicines. I was seeing a talk therapist weekly, and nothing helped. And a friend of mine suggested that I participate in a medicine ceremony. And I kind of went into it very skeptical and half thinking that I might die because drugs can kill you. And I didn't have, in my ceremony, I didn't have a mystical experience. I didn't have ego loss. I didn't experience oceanic boundlessness. I didn't have any of the metrics that I've been trained now to look for in terms of markers for success of a psychedelic journey. I just giggled for 5 hours. But when I woke up the next day, I was completely cured. And so that certainly was noticeable and struck my interest. And then it was about 2 years later, I met a patient who told me that he had a regular practice of using these medicines, not to heal mental illness, but really just to better his wellness. And I was really intrigued by that and started studying. And that led me to end up becoming certified as a psychedelic medicine therapist in 2018. So I'd say those two pivotal moments, my own first experience and meeting a patient with extensive work history in this field, is what led me to where I am today.
Wow, what a story. And thank you for the candor. And I really appreciate the very clear language, this talk about it cured you. And I think that's powerful. And speaking of
I mean that word,
ketamine, that you're working with patients at Field Trip. This is a unique experience, a brave new world, if you will. For you, Randy, what is the most satisfying part of working with ketamine with patients? And maybe what's the most challenging part?
Well, to circle back, I really do mean the word cure. You know, a lot of times in medicine, we'll just look at, say, depression, and we'll look at a patient's depression score. And after they're on Prozac for a few months, their depression scores go down a little bit. That's not a cure. What happened to me, my depression was gone. And so to fast forward to your question, what is the most valuable thing about working with ketamine? It can affect a cure, just like what I, experienced. I recently took care of a man who had about a 30-year history of alcohol abuse. And after about 10 hours of talking with him and one ketamine journey, it's been about 8 weeks and he's had zero interest in drinking at all. So now I'm not sure I'd feel comfortable using the word cure to describe his alcoholism because, it's only been a short horizon, but I mean, the benefit to that particular patient has been profound. And not everyone who goes through psychedelic therapy gets that immediate type relief, but most of the time relief comes through a series of steps. And that's why a series of, or a course of ketamine-assisted therapy can be 6 sessions or so.
I appreciate that concept of a series of steps. It's consistent work. I'm
Yeah.
curious, what about a challenge? Any challenge that's jumped out in your experience so far?
Yeah, part of why we use ketamine is because it's legal. It's a Schedule III medicine. And so there aren't any hoops that the government makes us jump through to use the medicine. We can basically order it from a pharmacy and use it in an off-label context, totally legally and within DEA regulations. The challenge is that some of the other psychedelic medicines that unfortunately the DEA has continued to classify as Schedule I substances, those other medicines that are currently off limits seem to be considerably more impactful than ketamine. So, I would call ketamine psychedelic training wheels. It's a great medicine. It does a lot of good work. It helps a lot of people, but it's got its limits. And our hands are basically tied until the government is willing to change their attitude.
I love this idea of training wheels. That's brilliant. Speaking of which, I'm curious because I believe you've seen both, obviously with ketamine, and I think you've actually worked with a patient as well on psilocybin. Correct me if I'm wrong. How do you see the difference between what patients talk about after a ketamine treatment versus psilocybin?
From my experience, as well as from my review of the available published medical literature, psilocybin is more likely to affect what is referred to in our industry as a mystical experience. And that is an experience that is completely not capable of being described by language, just like you cannot describe the difference between blue and red to a blind person using language. It's just not possible. It's ineffable. A mystical experience is ineffable. But in short, the most immersive type of mystical experience feels like a transfer of knowledge from the universe into a person that teaches that person that their individual existence as an isolated self is actually a very, very complicated illusion, and that our consciousness is actually confluent with a self-aware energy that permeates the entire universe. Now that sounds to a Western-minded scientific person like absolute nonsense, like New Age woo-woo. But what's interesting is the reason that a mystical experience sounds like New Age woo-woo is entirely because of the bias inherent to our cultural beliefs. And because everyone in the scientific community and basically our greater culture at large believes that consciousness is made in your brain rather than being an energy that permeates the universe. Any experience that questions that dogmatic scientific paradigm has to be wrong within the mind of a scientist or a
That's such
Western-minded industrialized person.
such a good point. And I think this idea of also the language as an interface being inherently limited. But this idea you just mentioned of a transfer of knowledge from the universe to the personal, that's fantastic. And I think it's very well articulated, very difficult topic. Speaking of which, you've had, I believe, at least one, maybe multiple mystical experiences. And one of them, in fact, something about a rainbow and Om and vibration. If I may, please tell the viewers about your experience.
Yeah, so that was a life-changing moment. I was participating in a ceremony, and I closed my eyes, and instantly my consciousness was disconnected from every single thing that related to the physical universe, including Randy and any concept that I am a human. And to go back to my language where I said I described a mystical experience as a transfer of knowledge, that was really just language that I chose to communicate with your listeners who might not be understanding what a mystical experience is. Because to be more accurate, what I experienced wasn't really a transfer of knowledge, but what I experienced was actually a remembering of the true nature of my consciousness. And as I was in that medicine ceremony and closed my eyes and all of the physical world vaporized, nothing at all changed about my consciousness. It stayed just the way it is. It just didn't have a Randy associated with it. And while I was in that state of pure consciousness, what I would describe as my visual field was filled with a wave. It was almost like the surface of an ocean that was colored in a rainbow fabric. And this ocean was undulating. And it was undulating at a very specific pace that after I came out of my journey, I realized that the cadence of that vibration was the sound Om from Vedic Hinduism. And Om is thought of as the sound of the universe. And I didn't understand what was happening to me at the time. But when I came back out of it and I came back into Randy, I knew that that was some profoundly significant experience that I had to learn about. And so I just jumped down the rabbit hole and started learning.
Randy, that is beautiful. And thank you for sharing. And I appreciate your mention of the shift in the nature of your existence, which is a really tough one to kind of articulate. I'm curious whether it was that experience or others, what revelations from these journeys do you think still impact you today?
Oh, well, without question, that experience of remembering that my consciousness is confluent with the entirety of the self-aware energy within the universe, I didn't really know what to make of it in the moment. And so what I needed desperately was to integrate that knowledge, that experience, in a way that it affects my life. And so the answer to your question is that I now no longer identify as a being called Randy. I identify as the consciousness that sits behind Randy's experiences. And the way that that affects my life is it makes me much more immune to the regular trials and tribulations that a human goes through. If the world doesn't turn out to be the way I hope that it would be, get something that I'm hoping for, or I don't.
It's like you get your conscious experience that you currently have or are gets this Randy Scharlach roller coaster ride. You get to experience it. That's
Exactly.
brilliant.
Yeah.
It's
I
so
mean,
well
to
put.
me,
I'm
life now
curious, Randy, this
feels like
idea
a
of
video game. And my true nature is the player sitting outside the universe playing Mario, but this is the Mario that I'm playing.
So, Randy, switching gears a little bit towards the more industry level of psychedelics, it's a very fascinating question to think about. What is it exactly that makes psychedelics so good with change? And yet it feels like even with this NIH director news, we still have a long way to go with American culture and shifting the paradigm. And I'm curious your opinion on the best way to educate the people that are perhaps on the fence.
Yeah, well, so there are many people in the psychiatric and psychological industries who really don't understand how psychedelic medicines work. They're seeing it as just one more medicine in the armamentarium that happens to lower scores of assays of depression and anxiety. But those people are fundamentally misunderstanding the way these medicines work. The way these medicines work is that they induce a shift within the person doing the work, a shift in the way that person sees themselves as a self and the way the person sees themselves fitting into nature at large. Most simply, without psychedelic medicine work, especially in Western cultures where our society is garnered towards the individual, we all feel like isolated individual selves that don't have any connection to anything else. We don't have a connection to others or to nature. But psychedelic medicine work shifts that perspective. And many, many people who go through a course of psychedelic therapy come out the other end feeling like there is a profoundly deep connection between everything that exists, especially between all living beings. And it almost feels like we're all the same being, just incarnated slightly differently. And when you have that sense of love and connection to every other human, it's impossible to engage in conflict. War would just is unfathomable. And the two best sayings that I know that really highlight that teaching. One quote is from the Dalai Lama. He said that if all children were taught to meditate starting at age 8, within one generation, there would be no more human conflict. The other quote is from Stan Grof, who said that psychedelic medicines are the only thing that can save industrialized culture from its suicidal course. And both of those quotes are basically saying the same thing, that whether it's meditation or whether it's psychedelics, once a person feels like they're part of nature and a part of a greater whole, then it just becomes intuitive that our role here on Earth is to take care of each other and take care of the planet, rather than exploiting each other and exploiting the planet.
Randy, those quotes are so apropos, and it sometimes feels like it's easy to fall into hyperbolic phrasing with psychedelics, and yet it feels warranted. And I love the language you use, this idea of inducing a shift. And I think you are one of the best in the biz when it comes to discussing these ineffable topics. And switching gears a little bit, I'm curious about your take on the frequency for these substances. For me personally, I've found for a pretty long period, about 4 or 5 years, that once a month was the right cadence for me. And yet now I find myself shifting and feels like that actually isn't right for me at this current stage. It's such a tough question, but I'm curious, how do you approach this idea of what is the right amount to microdose or macrodose for each person exploring psychedelics?
I won't comment on microdosing. It's outside my skill set. I've read Jim Fadiman's book, but I don't feel like I have a command of that knowledge enough to contribute to your podcast. So I'll limit my answer to macrodosing. And your question really is about frequency. And I think you've actually already answered it the exact way that I will answer you, which is that it's very individualized and that what's right for any one person can change over time. I mean, basically, the way to think about work with psychedelic medicine is that it's a pathway. It's like going down a long trail, like the Appalachian Trail. There's thousands of miles, and there are parts of the trail that are probably easy to traverse, and parts of the trail that are really exceptionally challenging, and you need a guide. And as a person goes through their journey of self-improvement through yoga or meditation, with or without psychedelic medicines, the landscape and the challenges evolve and they change. And as the person grows and changes, their relationship with the medicine can change. And so that's not an answer with any specifics to it, but it's the best answer I can give you, which in summary is that it really needs to get individualized for the person and where they're at on their journey.
I appreciate that. Individualized for the person. That really sounds a lot like precision medicine. At an even higher level, Randy, this idea of rebranding and the connotations we have from the 60s and 70s of the idea of a trip, or even perhaps the word psychedelics. What are your thoughts on the idea of needing to rebrand in order to get full acceptance?
That's a great question. Well, to take those two words in particular, I actually do like the word trip. I agree with you that I think there can be certain negative connotations with that word that's associated with some of the social upheaval that we experienced in the late 60s and early 70s. But at its core, a fundamental aspect of psychedelic work is that it takes you to a different place of consciousness. I refer to the ceremonies as going on a journey. And trip is kind of another word for journey. And the reason that it's a journey is because you really do have your mind leave this, the matrix that we appear to be in, and you go somewhere else on a journey or on a trip. And so I don't have any hesitation to adopt and continue that vernacular. In terms of the word psychedelic, I think it's an appropriate word. I tend to not use psychedelic medicines to affect psychotherapy. My call towards this work is using psychedelic medicines for really what I think could be called spiritual work. And that would require a whole separate podcast to get into that. But along the lines of using psychedelics for spiritual work, there's another word called entheogen, which means manifesting one's inner divinity. And that is my preferred choice of word when talking about these substances, entheogen. But I certainly don't have a problem with psychedelic because I think it's a well-accepted word and it is well-intentioned.
Randy, I could talk with you on this topic for hours, I'm sure. One of my most favorite interlocutors on this topic, so articulate on such ineffable concepts. So that's it for the deep dive. We're going to switch over to a soul search. And the idea, Randy, here is kind of a window into the soul of Dr. Scharlach, if you will, kind of a speed round style, 4 questions, 10 seconds or less on the response, if you can. Are you game?
No, I mean, I'll do it, but I am not really a fly by the seat of my pants thinker. I'm kind of more of a chin scratching contemplative guy, but I'll play along.
Something tells me you'll find a way to pull it off. Okay, question number one in the soul search. Randy, you're on a desert island for 10 years. You get to choose one mind-altering substance to bring along. Who you got?
Man, am I alone on the island?
Yes.
Cannabis.
Okay, dead or alive, what famous person would you like to have a psychedelic experience with?
Jesus of Nazareth.
Okay, question number three. Imagine that time travel is possible, just not yet. And all of a sudden, Dr. Randy Scharlach from 10 years in the future zaps into today, and he's going to get zapped back. What do you think he might tell you?
What would the 10 year from now Randy tell me right now?
Yes.
Stay on track. Keep the course.
Oh, that's good. I love that. Okay, last question, kind of a cousin of that last one we just had. Imagine that time travel is possible and now, and you get to go back to Randy at 10 years old, and you get to give him one gift. What would that gift be?
I would tell 10-year-old Randy about the bias inherent to Western industrialized society that dates back to the time of Rene Descartes, Galileo, Isaac Newton, and was perpetuated by some of the interpretations of the work by Charles Darwin, perpetuated by B.F. Skinner. I would tell Randy about how the fathers of quantum mechanics in the 1920s, almost all of them, the guys that not are doing work with quantum mechanics, but the guys who figured it out, almost all of them realized that there is an intelligence behind the universe that our Western culture denies. And I would tell 10-year-old Randy that as he's going through his Western education, as he's going through his science classes, as he majors in chemistry in college, to always be aware of the fact that the stories behind our scientific assumptions are just assumptions. And I would tell 10-year-old Randy to keep his mind open for seeing the world in another perspective besides that which inundates our culture.
Randy, I love this answer. And I must say, if 10-year-old Dr. Scharlach would have been able to process that, you were a much smarter child than I was. Dr. Scharlach, thank you so much for joining the show.
You're welcome. I'm not saying 10-year-old Randy would have understood it, but I would hope that as he ages, he'd keep referencing back to that conversation and go, oh, piece by piece, I'm now starting to understand it more.
I like that. Well, as we move along to our final segment of the show, producer Kevin, the Noodle. Something I've been noodling on of late is this idea of precision medicine and its overlap with psychedelic guiding. Now, precision medicine is this idea of taking genetics, environmental factors, all the nuances of your behavior, and using these highly detailed pieces of data to really craft your treatment. And it's a really cool concept. And yet I worry sometimes with guide work, are we approaching it in a one-size-fits-all manner? One person may need a particular type of guiding, another person a very different type, and then a third person may need no guide at all. And I'm certainly in that space. So precision medicine and psychedelic guiding perhaps is a really good answer. Well, that's all the time we have for today. Thank you to Dr. Scharlach, producer Kevin. Up next week, we'll have APA executive Jasper Simons. See you next time.